Have you ever wondered if you were insulin resistant? I'm Dr. Kalea Wattles, a functional medicine doctor specializing in fertility, and I'm going to show you 3 physical exam findings that may point to insulin resistance. First, we have a condition known as acanthuses nigricans. These are dark and velvety patches of skin that typically appear in body folds: the underarm, the knuckles, the groin, the elbow, the neck. I've seen lots of fertility patients have this, and without doing any blood work, I can already guess that they might have some trouble with insulin. Here's how this very same condition looks on a darker skin tone. The reason why we see these dark velvety patches is because insulin can actually bind to receptors for growth factors in the skin, and it causes certain skin cells to rapidly proliferate or grow. So if you have lots of insulin, you'll have lots of stimulation of those cells, and those skin cells will start building up upon each other. It's really important to note that insulin resistance isn't the only reason why we might see this. It can also happen with thyroid disease, with some other metabolic conditions. So if you do notice this, it's a great opportunity to chat with your doctor and have some blood work done. Next, I'll show you skin tags. These are small skin growths that often pop up in those very same areas where you'll see the dark velvety skin, especially around the neck. This likely happens for really similar reasons, that insulin stimulates growth factor receptors and causes certain cells in the skin to rapidly grow. These might be skin colored or slightly darker, but they tend to be attached to the skin by a tiny stalk. Finally, I wanted to show you hair loss. This is where we see a recession of the hairline at the temples, possibly down the center of the part, and we see an increased rate of hair loss to hair growth. This likely happens because insulin upregulates an enzyme called 5-alpha reductase, and 5-alpha reductase converts testosterone to an even more potent hormone called dihydrotestosterone, or DHT. DHT can then act directly at the hair follicle, causing them to grow smaller hairs with a shorter growth phase, meaning more hair shedding. Keep in mind that these signs are absolutely not required for insulin resistance. You won't see them 100% of the time, but if you do notice them, it's a great time to visit your doctor so that you can do a really thorough investigation and get to the root cause of the issue. I hope this was helpful. I'll see you next time.